injuries on the patient, and prepare for evacuation. Contact.
All right, bang, bang, bang. Casualty, can you return fire? Then you move to cover. Can you perform self-aid?
No response.
Lady Dad, I'm coming to you. Tactical leader, do we have fire superiority?
You have fire superiority.
Security, bound forward past the casualty, set in place. Give me the signal when we're all clear.
Medic!
Performing visual blood sweep. I see blood. Security, let's get ready to take them off the units.
Given.
All right, let's go. Security, 1, 2, 3. Hey, can you hear me? Are you all right?
No response.
Checking for signs of life.
You have signs of life.
Blood sweep.
No
Checking for
blood.
blood. Checking for blood.
No blood.
Checking for blood.
Bleeding uncontrolled.
The wound is above the tourniquet. It's doing nothing for me. Feel push, pile pressure, always check for exit wounds. Feel push, pile pressure, always check. Did I check for exit wounds? No, I didn't. Checking for exit wounds.
No exit wounds.
See how that saves y'all, Soldier Max? Feel push, pile pressure, always check for exit wounds. Feel push, pile pressure, always check for exit wounds. Feel push, pile pressure, always check for exit wounds. Hold pressure for 3 minutes. Security, go to hold pressure while I continue my blood sweep. Checking for blood. Checking for blood. Checking for blood. Checking for blood. No additional bleeding found. Airway. Move the ACH. Head tilt, chin lift.
Casualty is unconscious.
All right, and I'm going to drop in an MPA from the IFAC. Right nostril. Make sure it's secure down with tape. And this isn't flagged at all. I don't even know if I'm grabbing the right part. All right, airway secured, breathing. Okay, I'll do that stupid trick. There we go. Checking for entry wounds.
No entry wounds.
All right, I can't sit him up because of suspected pelvic compromise. Stop putting bulky things in your pockets, Jones. Checking for exit wounds during breathing.
No exit wounds.
Checking for spontaneous respirations.
You have equal rise and fall of the chest.
Shoulder girdle, clavicles, sternum, rib cage. I'll go ahead and apply my pull socks. Top. All right, 3 things in 6 alpha. Only one of them applies here. Trail non-pulsar hemorrhaging, nope. Convert hasty to deliberate, nope. Reassess packing of junctional wounds. Bleeding still controlled.
Bleeding is still controlled.
All right, continue to hold pressure. Check your bilateral radial pulses.
Radial pulses are absent.
All right. Continue to hold pressure, security. Once you get the chance, you're gonna set up this blanket on the litter, diamond shape, silver side up. Take off the boots and socks, loosen any restrictive clothing. Pulses are absent. First thing I'm gonna do, prep my TXA before I attempt my saline lock. And if I fail my saline lock, 2 unsuccessful attempts, I will have to go straight to IO. Lead. TXA, 10 for TXA. Sharks. My line is bled. Now I can push my TXA into my bag of 100 cc's of normal saline. Sharps container, sharps. Mix it up. TXA is good to go. So now I can work on establishing my saline lock. My casualty's arm. I'm gonna prep everything I need for that. Medics always forget about tape. That's like the first thing I want to touch. One strip for the saline lock, another for the line, and the roll for when I need to secure my tubing. Go ahead and prepare my flush. Flush is good. Level up, see a flash, drop, advance, include, control, sharps, taping it down. gonna make sure it's good. Hey, can we get oh, the litter's here. Okay, good. Aspirate. Flush. Sharps. Tegaderm. Alright, so next up, got my vascular access, so then I could work on my tubing. Alright. Sharks, veins wide open once again. So I need to make sure I control sharks. Connect my tubing. Tape it down. Alright. Go ahead and initiate flow of fluid. Drip rate 2 to 3 drops per second. Alright, security, tell me when 10 minutes has passed or when the bag's nearly empty. Before I move on, let's secure the rest of this. Alright, outstanding. We got our vascular access ready to go. Alright, so let's go ahead and get them on. Actually, no, not yet. Right? Because we're in 7-up, which means we got to wrap it up. Alright, so let me wrap this junctional wound. Thanks for holding pressure. Security. Inguino requires a Curlix on top. Open one of those up. I'm going to need one of these. I'm going to need one of these. Alright, let's begin. I'm going to put some pressure on this. So I put it on top. Alright, hold it in place again. We're almost there. Alright, go ahead and let go gently, gently. Cover.
Jones with the double sock.
Fucking double sock kids.
I'm signing one thing.
Alright, I'm just going to tie it off as it lies. Not enough slack. Even these out. Pull some upward pressure. Close the gap. Tie it off. I don't have to worry about taping or swathing until later on in my assessment. That's good for now. Step 8, communicate. Tactical leader, I have a non-line medevac request.
Send it.
Alright, line 3, Alpha 1, line 5, Alpha, line 5, Lima 1, how copy?
We've got the ETA on the bird is 15 mics.
Alright, burrito time. Let's go. Then bring that a little closer. I'm gonna inspect the back for decap BLS. So I'm gonna look before I touch. Then I'm gonna palpate for step off. Check for buds. All right, 1, 2, 3. Cover them up. All right, step 10, do it again. So do it again means I'm gonna reassess my prior interventions. Is bleeding still controlled?
Bleeding is controlled.
How's my MPA looking in my airway?
MPA patent.
How's my breathing?
Equal bilateral.
How are my pulses?
Still absent.
Pulse ox?
98 and 117.
What's my TXA looking like? Line
TXA is still
dripping?
flowing.
All right, outstanding. Step 11, all dogs go to heaven. Check ID tags for any drug allergies. Is my casualty still unconscious?
Casualty is still unconscious.
All right, they wake up at any point. It's probably a safe bet to give them ketamine since they're at the risk of shock. And I could do it either IM, 50 milligrams every 30 minutes, or I could use the IV port, 20 milligrams every 20 minutes. Step 12, top shelf. So first thing I want to do is I want to look before I touch, inspect for decap BLS. I see a head wound up here, noted. If I have time, I'll treat it. I'm going to palpate for tick. So now I want to touch. Let me get out my pin light. I'm going to check both eyes for pearl. Check the ears, the nose, the mouth for CSF. That takes care of the head. I'm going to inspect the neck for decap BLS. Palpate the C-spine for step off. Tracheal deviation, jugular vein distension. As I go down, I want to expose everything I need to see. Once again, I'm going to inspect the chest for decap BLS. I'm going to palpate for tick. I'm going to auscultate. All 4. Breathe in, breathe out.
Clear.
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 All right, all long fields clear to auscultation. Outstanding. I'm going to inspect the abdomen for decap BLS. Palpate for turd P. Move down to the pelvis. Expose, expose. I'm going to inspect the pelvis for decap BLS. Palpate for tick. I want to be careful because of this injury. Work my way down to the legs. I'm going to go ahead and expose. Expose. I'm going to inspect both legs for decap BLS. Then I'll palpate for tick. Trying to rub those long bones together in case there's any broken ends. Alright, I'm going to check pulses. Motor sensory function. Can you wiggle? Can you feel? It's got motor sensory function. Alright. Inspect the arms. decap BLS. Palpate for tick. Long bones once again. Checking bilateral radial pulses.
Present.
Checking motor sensory function. Can you wiggle? Can you feel? That completes all 20 points of my detailed physical exam because I already checked the back. Step 19, they're already on the litter. Don't have to worry about that. Step 20, do it again, do it again. So I'm going to reassess my interventions. Bleeding still controlled.
Still controlled.
All right. Only this time, I'm going to secure everything. So I'm going to tape this up. Ah, Grinch fingers. Who enters our domain? All right, tails are secured. Junctional wrap is not complete without a swab. Above the knees, keep the legs together. All right, there we go. Close it up. Outstanding. All right, in the event of this head injury, I'll go ahead and wrap it with Curlix while I'm waiting, in case I have enough time. Do you know what time I'm at?
ETA on bird 10 mics.
10 mics. That's plenty of time, but okay. All right, so I'm gonna go ahead. Step 21, germs are no fun. Actually, I didn't complete step 20. I still need to reassess my ABCs. How's my airway?
Patent.
How's my breathing?
Equal bilateral.
Our pulse is still absent.
Pulses have returned.
All right, pulses have returned. So I can go ahead and disconnect my line. I'll get to that. All right, so step 21, germs are no fun. Casualty still unconscious?
Still unconscious.
Okay, so then since they can't take anything orally, I would administer 1 gram of vertipinum. I am. Alright, step 22, documentation for me and you. Start filling out everything on my TC3 card. Security, can you go ahead and start wrapping and strapping my casualty? Let's get these buckles buckled in. Make sure he's covered. You could actually tape it down as well while I fill out my documentation. Yeah, both ends are underneath. Alright. So as I fill this out, I want to mark any of my injuries with an X. I'm going to get my first set of vitals. So I'm going to take a look at my pulse ox to get my pulse rate.
Pulse rate is 114.
Alright, I'd write that down. Also note the current time I'm taking my vitals. What is my O2 sat?
O2 sat reads 92.
Alright, blood pressure. Does he have a radial pulse? You said yes, right?
Present.
Okay, so radial pulse is present. That means 80 over P. Respiratory rate, I'm going to count out for 15 seconds. What do I have?
Respiratory rate is 26.
26. Alright. APU unresponsive. Can't tell me a pain scale. That's my initial set. What kind of treatments did I do? Junctional, wrap, pressure dressing. I put in an MPA. What kind of fluid did I give? 100 cc's of normal saline. I didn't get any blood products yet. What analgesics did I give? Nothing, because he was unresponsive. I did give 1 gram of vertipinum. I did give 1 gram of TXA, so I could write that all down here. I did hypothermia prevention, which was the blanket. Is there anyone around to give me an ample history?
No.
Alright, so I'm going to sign it off with my last name, first name, my last 4. I'm going to go ahead and tape it up to my cavity, make sure it goes with them. We're already taking care of step 23. So the last thing I will do, step 24, I will continue to reassess and reassure my casualty until medevac arrives.
You are a go at this station.
Yes! Did that seem easy, Soldier Medics?